let's talk about something that nobody really wants to talk about, labiaplasty. So a lot of people don't know what labiaplasty is or don't know why somebody would need one, but I will tell you that over 90% of my patients come to me for labiaplasty, not necessarily for the look. They're coming in more for symptoms. So a lot of patients have irritation in the area. It can be painful or irritating during exercise. You can see it in yoga pants or in swimsuits. It can be painful whenever you're with your partner. And so that's the most common reasons that I have patients coming into my office to see me for labiaplasty. Other people do want it for more of a cosmetic look, and that is a benefit. Even if you're having those symptoms, you do have a little bit of an improved cosmetic appearance. What do we do with labiaplasty? So with labiaplasty, I do the vast majority of those procedures in my office. You're awake the entire time. I put numbing cream on prior to doing any kind of injection with local numbing. And so most of my patients are very, very comfortable throughout the entire procedure. They're talking back and forth with me as I'm doing the procedure. Now there's a couple different ways on how we perform labiaplasties. There's two main techniques that people talk about. So there is a wedge technique and there is a trim technique. And people definitely go on one side or the other, whether they are team wedge or team trim. I, 90 to 95% of the time, am on team wedge. The reason why, I think that you can get a nicer scar, it's better hidden, and then I can also not only decrease the amount of labia that's coming out, but also decrease that anterior-posterior dimension, so kind of make it shorter, pull it in nice and tight. I think you can get that nicest, cleanest result with that wedge approach. Also, the way that the scar is placed, it's also in an area that's a little bit less irritating, and I think those stitches kind of dissolve a little bit better as well. Now, anytime that we're doing a labiaplasty, I can also do an extension up the side, which is called a clitoral hood extension, and that kind of helps a little bit of that extra width up the side. During your initial consultation, I'll go over which one will be best for you. I also talk about what areas might pose a problem for myself or might pose a problem for you as far as healing is concerned, and we go over all of those details. The day of your procedure, like I talked about, you get that numbing, you get that injectable numbing. It takes me about 30 to 45 minutes to do the actual procedure. Most of those stitches are all dissolvable except for a couple that I'll just kind of clip at the end at about a week or 2 weeks out. We give you a full kit that helps you recover afterwards, which includes kind of panty popsicles, like we call them, some witch hazel spray, wash, and all of your post-operative medications. Then you typically come in and see me 1 to 2 weeks after your procedure. And then there is no intercourse or no heavy lifting or exercise for 6 weeks after surgery. That's kind of the bulk of it. So send me your questions and I'm happy to answer them. Welcome to my little sheet of what I use for all my patients who are getting labiaplasty consults. So I make these worksheets for all of my procedures that I perform most often because it helps me to just kind of create a mental checklist, go over it with you, and it also helps me to explain everything to my patients as I'm going through. So the first thing up here, you'll notice complaints. And one thing that you don't notice here is for just cosmetic reasons. While that's definitely a reason that people want to pursue labiaplasty, these are the most common reasons: pain, itching, rashes, infections, discomfort in clothing or with activity, dyspareunia, meaning pain with intercourse, visibility in clothing, or self-consciousness. And so those are the most common things that we notice with our patients, and we just kind of check those off to see if you're having improvement of all of those symptoms after your surgery. Then we talk about open commissure versus closed commissure. If you notice, whenever people stand up, sometimes the front area is open like this, and sometimes it's completely closed off. So I'm looking at that. That's actually something that we can't change that much during surgery, so we're just noting that. Then we talk about the length of either one of your labia, where the excess is, how thick your tissues are, whether there's 1 takeoff, 2 takeoffs, or 3 takeoffs, which has to do with how this is coming off right here. And then we talk about whether you have clitoral hooding or not. We also talk about if you have any other symptoms at that time. And then we talk about either a wedge or a trim. So a trim labiaplasty is where we take off all of this excess in this dimension right here. So say that if you had extra right here, we'll take off all of this tissue and your scar will be across right through here. Now, a wedge, which is what I personally prefer, you're performing that scar. So you're gonna cut right across here, right across here. This is gonna come this way, that's gonna come that way. And then you're removing, to me, a little bit more of that tissue. Now this comes in tight this way, that comes in tight that way. So now you're just left with a scar that comes up the middle and down the backside. I think this scar is a lot less conspicuous and this pulls tighter so you don't have that extra kind of towards the back, which a lot of people don't like, and towards the front where people don't like. So this is my preferred method.